everyone, and welcome to this episode of Ask a Death Doula. My name is Suzanne O'Brien. Yes, the Discovery webinar is coming up. The Death Doula Discovery webinar is coming up very soon. You can secure your seat with the link below. If you are interested about the Death Doula movement, what the profession is like, come to that webinar. It is free. I will be on there live and I'll stay on and answer all of your questions. Just click the link below and I'll see you there. Okay, today we're talking about what does a death doula do? You might have heard a lot about death doulas in the news. They are all over. It is a beautiful movement. But what exactly does a death doula do? We're going to break it all down today. So first, let's start out with what is a death doula? A death doula is a non-medical professional that is trained to provide emotional, physical, spiritual, and informational support to a patient and their family before, during, and after death. And so I want to highlight a few key words within that description. Non-medical, so important to understand. But are they educated in medical? Yeah, many times, depending on the training, depending on the death doula. However, the definition of the role is that of a non-medical, and that is critically important. The other is holistic. Holistic meaning emotional, physical, spiritual, mental support. We are holistic beings, and may I take a minute to remind us that we just forgot that death is not a medical experience. It's a human one, and it's a holistic human one. And all those parts of our being need to be addressed and supported at the end of life and in life. So when I started working with those at the end of life, by the way, my name is Suzanne O'Brien. I'm a former hospice and oncology nurse with over 20 years in the end of life space. The minute I started working with those at the end of life, it taught me everything about how to live. My whole life changed in the best way possible. We are holistic beings, and we need to be nourishing each one of those parts of us, which we're basically not doing now. That will be in another podcast about life. Let's talk about what death doulas do and the holistic way that they practice, because it's critically important, especially at the end of life. When this is it, when all of our stuff shows up at the end and we've got to create healing, harmony, closure in all of the parts of us, in all the holistic parts of us. So we've talked about what an end-of-life doula is. It's a non-medical holistic practitioner that cares for somebody physically, emotionally, spiritually, mentally, and informationally support at the end of life. But a key before we get there, during the end of life, and after, just like a birthing doula. But for the other end of life, the end of life. So let's break it down. What exactly does a death doula do? We act as the eyes and ears for the medical or hospice team. Remember, we are non-medical practitioners. However, there's gaps in end-of-life care. We call it the hospice gap. Hospice, beautiful model of care, end-of-life provider of care. Unfortunately, the current model does not work. Why? Because it's set up with the reimbursement structure. There's no criticizing, there's no finger pointing, there's just clear observation of where we are right now and what we need to do to change this so that people can have a positive end of life, because we have only one chance to get it right, and it's not going well for most people right now. This has to change. So hospice is your end-of-life provider, beautiful model of care. Unfortunately, the current structure doesn't work. As a hospice nurse, I was there for 1 hour once a week if my patient was what you call stable. As a hospice nurse, I'm supposed to teach the family how to do the end-of-life care. You cannot do that with 1 hour once a week. It's impossible. Death is the number one fear in the world. When people are fearful, they can't learn. If I'm there 1 hour once a week, I'm putting Band-Aids on it. And the other factor is that people are coming on hospices many times with just a few days, when hospice care is good for 6 months or less. It's the perfect storm, having end of life not be supported and not work at this point. I want to also remind you that Medicare recently did a study that determined that 98% of the end of life hands-on care is done by family caregivers, when they usually don't know the first thing about how to do end of life care. It's often cruel. It's cruel to think that this is on them, that they're caring for someone they love at home when they don't know the first thing about how to do that. The current system doesn't work. With no judgment there, with absolute heartfelt observation. We need change. Getting people to get trained, to know how to care for their loved one at end of life ahead of time is key. This is, by the way, a skill that 100 years ago, a grandmother used to hand a grandchild. We've all but lost it. Doulagivers.com offers that for free every month if you would like to learn those skills. And if you would like to share this with everyone and anyone that would like to take that training, please do. It's changing lives. In addition to that, we have death doulas now that are showing up to fill that space as non-medical practitioners to support not only the patient and family, but the mainstream medical team as well. So what do? They act as the eyes and ears again for the mainstream medical team. As a hospice nurse, most end of lives were not going well, and I was frustrated over and over again, trying to make a difference for my families, and seeing it not go well is the most heartbreaking thing when you know that it's hard enough, but it's made 1,000 times more difficult because families are not prepared. They don't know what to do. And going to my CEO of my hospice and saying it's not going well for most families. And he was saying, well, that's all we can do. That's all we can do. We can't offer any more. And I suggested training families ahead of time, training them with this complete training of how to care for their loved one from the start of terminal diagnosis all the way through to the end of life. And he looked at my training and he said, this is great. We can't do it. We can't use it. I said, why? He goes, we won't get reimbursed for it. It won't fit in the reimbursement structure. So knowing that the frustration within the system for mainstream medical practitioners, by the way, are all heroes and killing themselves to make a difference. What about if we took it out of the reimbursement structure where we had no time restrictions, where we could work with one family at a time? Yes, that's the answer. So having the death doula now be the non-medical support with no time restrictions that can be there for the duration, like a birthing doula. Like a birthing doula, holding that space for that patient and family for the duration, not running in and out of the house, being there the whole time, and because they are highly educated, acting as the eyes and ears for the mainstream medical team, alerting them of the very first change in the patient's presentation so that the hospice nurse can come back, reassess, change the care plan, allowing for the highest quality of daily living for both the patient and the family. This allows for the most positive end of life possible. Amazing, right? So there are answers. And I want to say to you, when you find something that isn't going well, that isn't right, and even when people tell you no, that you can't do more, find a way. Don't accept that. Find a way. People are having end of lives that are not going well, and we only have one opportunity to have it go well for that family and that patient. We have to find a way. This is the way. The second things that death doulas do are create living well aging plans. We can do that for the elderly ahead of time before they become end of life, because right now there is never been an aging population like we have today. We have elderly that are not at the end of life, but for decades are in need of support, holistic care, great love and education, and all the things for safety and living well and what they need, and they're not getting it. So we help to create living well aging plans for not only the elderly, but for people before we ever get to the end of life. What does that look like? What is the first choice, second choice, and third choice for aging well? And I think that should be the emphasis, empowerment of We know we're going to age. We just don't know physically what we're going to be aging like. We don't know cognitively what we're going to be aging like. And we don't know financially what we're going to be aging like. So we've got to prepare for all scenarios, all three scenarios. We provide holistic support to the elderly and their caregivers. That's what a death doula does. We also teach about life. This is one of my favorite things. And by the way, we will have many, many podcasts about life and what we've learned, life lessons. Working with those who are dying teaches us about presence, teaches us about compassion, teaches us about non-judgment, and teaches us how time is our greatest commodity we have, because we just don't know how much we have of it. So one of the things I'll impart to you right now is that the most important question that you'll ever answer for yourself is how you are choosing to spend your time daily and who you are choosing to spend it with daily. Because we just don't know how much time we have, and that's an unrefillable commodity. So please make sure that you understand that. And this space teaches us about that. It also teaches us about the importance of forgiveness. You know, when I've seen patients at the end of life utilize the power of forgiveness, they have been the most beautiful end of lives I have ever seen. You can use forgiveness in your life now. I know that it has changed my life and for many other death doulas as well. We educate the family on the physical aspects of dying, reinforcing hospice teachings, or even teaching where hospice was not able to because they're 1 hour once a week. It's impossible. We are there to help teach this family about the physical aspects of dying, what they can expect so that they are not frightened, and know what to do for interventions, for comfort, for their loved one in all three phases of end of life. Death doulas provide respite care and support for the dying and the main caregiver. So let's stop for a minute on this, because I cannot emphasize enough what the main caregiver is going through at the end of life and even for advanced aging care. I often think that there should be two separate care plans, and I know that our death doula graduates do this, is have not only a care plan for that end of life patient, absolutely, but one for the main caregiver as well. How are they doing? Are they getting rest? Are they eating properly? Are they stressed out? What's happening for them? Because by the time you come in as a death doula, many times that caregiver has been for months, years caring for their loved one, and they're very much burnt out. This is a real thing. So providing respite care for that caregiver, that they can, even if they don't want to leave the house, go in the backyard, take a nap. But I would encourage them to be able to step out of the environment, knowing that you will contact them if anything's needed. You know, always having a family member there, because we don't ever want death doulas to be the only provider in the home in case that medication needs to be given. That's a whole another thing. I'm going to talk about what we don't do, but really making sure that that caregiver is getting the, not only the rest that they need, but also if it's somebody who, you know, used to get their hair done or get their nails done or play bridge or go out to have lunch with their friends, even providing space for that to be able to happen so they can recalibrate and balance out, because they probably have not done that for a very long time. We provide connection for the dying person and their loved ones with local resources. I think that when you think of death doulas, I want you to think of a planner, you know, not a, well, maybe we can say an end of life celebration planner. And I know that that's sometimes hard to swallow, a celebration word within this. But I think that personally, our attachment to death is all wrong. I have been privileged to see some of the most beautiful end of lives with incredible healing and celebrating that life lived. And what about if we looked at it more in that capacity, with that energy? And if you think of yourself as that death doula that helps to create the plan, not a party planner, the celebration planner with all of the aspects to do with that end of life, helping to tie in with resources. Are you looking to have a home funeral. Let's do that. Do you want to have people come and visit here after the person has had their end of life? What kind of food do you want? What kind of readings do you want, or eulogies do you want, or music do you want? All of the things that we can create a beautiful space around this area. In fact, there is a huge movement with what you call living wakes and funerals. And so putting the fun in funeral. And again, not to ever diminish the pain that we have when we have somebody we love physically not here anymore, but changing our attachment to it, changing our focus to it to be more of that death positive. And so creating that way of thinking of the death doula as connecting with community resources, not only supporting in this space of the end of life, but also in the celebratory or memorial part of it, doing all of that and having all of those resources available that we can instantly give families. We provide assistance with advanced directive for healthcare at any stage of life. This is so important. The time to choose what we'd want or not want to make our advanced directives is way before we ever get there. And the death doula can do that. So we can provide that information at any point. We support the dying person and caregiver emotionally, physically, energetically, mentally, and spiritually. We are holistic beings. Everything shows up, all parts of us at the end of life, and also for the caregiver as well. We're saying goodbye to somebody we love. We have a limited time left. The family has a limited time left. What about all of the things that we have not discussed? What about all of the things that we have not had the conversations about, offered forgiveness for, asked forgiveness for? What about that? What about physically? What about mentally becoming at a place of acceptance that this is happening? These are all things that organically happen, not just for the person dying, but for the family members and the main caregiver especially. We foster open communication with medical professionals, hospice teams, and other caregivers, allowing for great continuity and support of care. You know, that hospice nurse, and I'll speak to myself as that hospice nurse, did not know that something was happening with that patient, that there was a change, unless family knew to contact me, and they didn't, because they didn't know it was happening. They were in shock and they were checked out. So we want to make sure that we have all of that open communication with family, with medical practitioners, the hospice team, and other caregivers. We facilitate doing life reviews. Life reviews are so critically important at the end of life to find, again, the meaning and contribution I had in this world, and to allow the patient to find the value and reach a place of acceptance that their life did indeed have meaning, and all of our lives have meaning. We help to create legacy projects. So there's simple ways to do that. You can do a legacy interview with the interview questions. You can create books. There's many different things. And one of the things that I love to do is help patients with presents or letters and cards that they want to send in the future. So one of the things that dying patients most have a problem with is what they're going to miss out on. They're going to miss seeing their grandchild get married. They're going to miss seeing their child, have the first baby. You can help them write letters and cards and then have them put for the future. Really powerful. Brings an incredible sense of peace. We encourage, again, forgiveness dialogue between the dying person and the loved ones. This is the space. This is it. Forgiveness is the tool. I cannot emphasize enough the power of forgiveness at the end of life and the power of forgiveness in life. Death doulas advocate for the dying person's final wishes. So many times this has come up where people would say, well, they should have this and we should do that. And I often will say, well, have you asked your mom what she wants? And what do you think the answer is? Many times it's no. So without anyone doing this on purpose, many times we will again project what we want as family members and put that emphasis out there when it's not about us, and lovingly reminding one another, the family, and everyone else, the caregiver, that this is about your mom and about what she would want. And I know that can be very hard and it might be different than what you would want, but the most loving thing that we can possibly do at this moment is support mom in what she would want. And I know that can be really hard acknowledging that, but making sure we've asked mom what she wants and then giving that to her. This is her journey, and we are there to support her in it. We help develop vigil plans. We want to create that vigil period, which is the last hours to days that somebody is in an actively dying phase. We want to create that sacred space, suggesting with music and candles, battery operated candles, and who needs to be there and what should take place in that sacred time. We encourage and evaluate the loved one's knowledge on how to lovingly care for the body before and after death. So making sure that they know how to do that and they know that they can do that. And that is something that is really important to offer. We provide grief support. We meet people where they are emotionally in their journey and work from that point forward with no judgment to be of the highest service. We do not take over. We meet people where they are emotionally at that point with no judgment. Again, for the patient and for the caregivers as well. This is incredibly important, holding the space as that sacred energy as that death doula. And so now that we've talked about what death doulas do, let's go over what we don't do. And when you are a death doula and when you are hiring a death doula, it's so critically, vitally important to know what they do and what they don't do. So what they don't do is they don't do any hands-on care. Think of them as the death coach, as that, again, that person that's holding the space, guiding you and educating you, reinforcing teachings, alerting the medical team of all of the nuances of change so that they can come back and change the care plan. They don't do hands-on care. Death doulas don't give any medical advice. Death doulas don't give any legal advice. Death doulas don't do mental health counseling. Death doulas don't administer medications, whether it's as prescribed medication or an over-the-counter medications. So when you are a death doula and you are going to be giving respite care with somebody, you want to make sure that there is always somebody that is in the home that can administer medications when they're needed. So you want that main caregiver to be able to have respite care, but some other family member or person needs to be in that home that is that person that can give medications, because death doulas do not give any medications, even over-the-counter ones. That has to be crystal clear. We don't do any medical care or wound healing. We do not do funeral planning. We can match with funeral resources, with different options, with different pricing. Absolutely. Think of the death planner, getting all of that information for you so you can make informed choices that are best for you. But we do not do funeral planning. We do not do will preparation. We can educate you on all the options and what you need to know and what you need to answer, but we don't do will preparation. We do not do wound care, and we do not, in the most loving way, take over. We meet you where you are in your journey, supporting you and working from that point forward. I know firsthand how difficult end of life is right now for most people. And I want to remind you of something. When it doesn't go well, families will remember that forever. And when it does go well, they will remember that forever. And 80 to 90% of a positive end of life can be achieved with two main things. Number one, planning ahead and thinking about what you would want or not want for end of life care. Who needs to be there? How do you fill the hospice gap with, again, a death doula? And also, how do you learn the basic skills of what it's like to care for your loved one, even if you're not planning to do all of that care, just knowing that what you are seeing is a natural part of the end of life process and not to be afraid can change everything. That is critically important. And then, of course, making sure that your wishes are in writing with an advance directive is incredibly helpful as well. Educating yourself and knowing what to expect for end of life and remembering that it is a natural process, not a medical one, and it can go really well and be the sacred, natural experience it was meant to be. And when it does, and you can hold that in your heart forever, when you think back on your loved one's last period of time in this world, it can be a memory that brings you peace, that brings you solace, that brings you joy of how peaceful and the conversations and just the things you experienced in that space for something that's 100% guaranteed. Shouldn't we have this available to all of us? And yes, the death doula movement is making that happen. They are filling the gaps that exist right now that are leading to most people not having positive end of lives. It's time for that to change, and you are part of that change. So now, knowing what a death doula does and what they don't do, you can feel free to hire one. Make sure that you know the training, that you know the services that they have. Just get your information on that. And if you want to become one, if this is your calling, and it is a calling, join us at the Death Doula Discovery webinar. It is coming up really soon, and the link is below. I want to thank all of you. Please ask your questions below. I'll do my very best to answer each and every one of them. This was the Ask a Death Doula podcast on what death doulas do. Thank you so much, everyone. We'll see you in the next episode.